disability, which makes reading, holding a book, or turning a page difficult or impossible. The content is copyrighted by the respective publishers. For more information, please visit us on the web at nfradioreading.org.
Hello, this is Fran McNamara, and for the next hour I'll be reading from the May 8th through May 14th, 2026 issue of Buffalo Business First, right here on the Niagara Frontier Radio Reading Service. And I'm looking at the cover page here, and oh my gosh, this is a topic near and dear to all of us, which is the cover feature, Special Report, The Future of Healthcare. The industry is evolving rapidly, requiring everyone from providers to educators to adapt to the changes and the challenges. And oh my gosh, it says it goes from pages 2 through 28, so this is certainly a special issue. Now, on the cover, it's kind of a unique picture. You have from the shoulders down what appears to be a doctor holding a tablet. And yes, he or she has a stethoscope over their left shoulder. And floating above the tablet is a heart. And it looks like an actual picture of a heart. So this is not a sketch, this is a photo. I'm sure it's Photoshop, but it's very impressive. Future of Healthcare. So we'll go to page 2. Oh, they do mention on the cover, too, there's going to be a list on page 29. I don't think we're going to get that far. And then Power People, we're going to look at someone that works for Highmark, Western and Northwestern New York. Okay, so let's get to page 2 here. And Josh Gilley writes the Future of Healthcare from the Associate Editor. As healthcare challenges mount, leadership takes center stage. It has been a year full of changes for Western New York's healthcare industry. Nursing home closures continued. Hospitals and healthcare systems cut positions and laid off employees. More pharmacies shuttered. Health systems faced ongoing staffing shortages. On top of that, 40 million new people have accessed healthcare in the last 15 years. But the future of healthcare, what this issue is all about, is not all doom and gloom. In the coming pages, you will see that industry leaders aren't sitting back and letting the chips fall where they may. Instead, many are working aggressively to adapt to changes and challenges. Strong leadership matters in moments like these, especially to an industry as critical to communities and to the economy as healthcare. Luckily, this region is home to dedicated professionals working to create solutions to the issues arising in the ever-changing healthcare landscape. A group of pharmacists and investors, for example, teamed up to open a community pharmacy at the former Akron Rite Aid. Their example could help other pharmacy desserts? That's a word. Okay. Their example could help other pharmacy deserts. Okay, I have no idea what he's trying to say here. Okay, but he says their example could help other pharmacies fill the hole created by the Rite Aid closing its Western New York stores. Local colleges have launched initiatives to solve physician shortages, including Duville's incoming College of Osteopathic Medicine and Damon University's Fast Track PA program. Several of Western New York's major healthcare organizations, meanwhile, are implementing long-term succession planning to ensure organizational stability during future transitions. The national picture remains challenging as well. Millions of people are losing access to care as costs rise. That is among the issues that Dr. Willie Underwood, a Buffalo-based urologist, will soon take on when he begins his term as president of the American Medical Association in June. All these efforts signal a region that understands the challenges ahead and is working to shape a better future for healthcare. Okay, now going back to Josh's sentence for a second, I think as I reread it, it makes a little more sense. Okay? What he's saying is there are pharmacy deserts. So I misread that. So what he said is a group of pharmacists and investors, for example, teamed up to open a community pharmacy at the former Akron Rite Aid. Their example could help other pharmacy deserts fill the hole created by Rite Aid closing 68 Western New York stores. Well, good for you, Josh Gully. Good. Page 2, Future of Healthcare. And now we go automatically to a weekly feature, Power People. And it says here, Buffalo Business First publishes 3 annual Power Lists. The Power 250, the Power 200 Women, and Power 100 Business Leaders of Color, featuring the top business leaders in Western New York. Each week we'll tell you more about an executive on those lists. And this week, it's Jessica Cox, president of Highmark Western and Northeastern New York. And by the way, her Power 250 rank is number 24, and her Power 200 Women rank is 22. Okay, now Tracy Drury will be posing the questions or areas of discussion to Jessica. And Tracy writes, it's been nearly 2 years since Jessica Cox joined Highmark Western and Northeastern New York as president, a role that includes overseeing operations in the Buffalo and Albany markets. The company, an affiliate of Pittsburgh-based Highmark Health, is Western New York's largest commercial health plan, reporting net gains for 2025 of $101 million on revenue of nearly $3.1 billion. With offices at Seneca One downtown, Cox oversees a workforce of 1,400 plus who manage services for nearly 500,000 members. A native of Elmira, she lives in Orchard Park with her husband, Bill, and is the mother of a grown son and 2 stepsons. Okay, so Tracy asks Jessica, what was the most pivotal moment in your life? In my mid-20s, Jessica says, I lost my first husband to cancer when my son was 18 months old. It was right after that a family friend approached me and asked me if I was interested in a position at Blue Cross Blue Shield as a field service representative for providers. I said no at first. I wasn't sure I wanted to go into medical insurance. I'm a medical technologist by background, working in hospitals 3 to 11 on weekends and holidays. He said it was Monday through Friday, 8 to 5. So with an infant at home, I quickly said, let's try it. Tracy Drury now says, well, what's a lesson you learned from a mistake? Well, early on, especially as a young leader, I tried to just jump in and take charge and change everything. I was so go-getter and would take change and try to fix it all the way. I was a go-getter and I would take charge and try to fix it all the way. I thought that was the right way. I've learned over time it really takes the perspective of the whole team. There are lots of lessons from that. What is your favorite thing to do in Buffalo? And she said, I love being outside. I have been a golfer, though I don't have much time, and my game is lacking at best. I love the festivals. We love music and the farmers markets. So Tracy asked Jessica, if you had to choose a different career, what would you pick and why? She said, I would buy and sell antiques. My father was an antique dealer for over 50 years, and he brought me from an early age. I would repurpose anything old to make it new again and help people understand the vision of that within their homes and workplace and how we can salvage the old to bring it new life. So Tracy asks, what's an interesting fact about you that not everyone knows? And Jessica responds, I was in the ballet, The Nutcracker, 10 times. Excuse me, I was in a Russian ballet company in my youth. So then Tracy asked, what was your first job and would you do it again? And she said, my first job was at the American Cookie Company, scooping and baking cookies. I would probably not do it again. To this day, I don't love chocolate chip cookies. So then Tracy asks, what's the one thing you look for when you're hiring someone? And Jessica answers, intent in the answers they give me and in knowing who they are. I want to make sure they're being true to who they are when interviewing. That's a time when people can try to be someone else. So Tracy asks, how do you describe yourself as a boss? And Jessica answers, empathic, but every direct and continually driving forward, driving people to be accountable and helping people continually to understand that we are reaching toward. What are you listening to or reading that makes you laugh? And she said, Schitt's, now that's SCHITT, it's a TV show, Schitt's Creek. I will rewatch those episodes just to purely step back and remember the humor we need to have with ourselves and our situations. So that's it for Power People. This time it was Jessica Cox, the president of Highmark Western and Northeastern New York, and that is the end, my friends, of page 3. Okay, now on page 4 we have an article, this by Tracy Drury as well, and it's under the heading Future of Healthcare, Succession Planning. And there's two ladies standing here facing the camera with big smiles, and it says, incoming Horizon Corps CEO Brandy Vandermark Murray on the left, and retiring CEO Aaron DiGirolamo. Okay? These leaders aren't leaving the future up to chance. Buffalo Health Systems focus on identifying their next leaders long before they're needed. So Tracy Drury writes, I mispronounced Aaron's name when I saw the picture. When Aaron DiGirolamo announced in February she would retire as CEO at Horizon Corps, there was little speculation at the agency about who would take her place. The nonprofit behavioral health agency began a succession plan for its senior leadership team 5 years ago, ensuring stability not only for the leadership, but also for operations across the $90 million organization. President Brandy Vandermark Murray will become president and CEO this July when DiGirolamo steps down and shifts to a consulting role through year end. I planned this all along, Aaron says. She had been CFO before becoming CEO after the retirement in 2023 of longtime executive Ann Constantino. And Aaron adds, succession planning isn't this thing that we do once a year. It's an active, ongoing conversation. Healthcare organizations know the future of their organizations depends on consistency and smooth transitions when it comes to leadership changing. Some focus on internal development, relying on board members and other key community members to identify who comes next. Others see advantages in working with executive search firms to find leaders outside their organization of the local geographic region. Aaron said planning for a successor took some of the stress out of her decision to retire early. So did identifying who would replace her successor and even down the line. The organization has a flow chart looking at the next 15 years with each leader providing an estimated date they plan to move on or retire. It's fluid if plans change, but it gives the agency time to plan. And Aaron adds, I'm always building who's going to be smarter and more capable than me that comes after. You have to give away that power while you're in that seat. It feels to me a lot like planning for college for your kids. It shouldn't be a surprise, and it's the best thing you could possibly do for them. Start the conversation early and do the hard work. And before we continue, hey, I have to tell you this. You're listening to a reading of articles and features from Buffalo Business First on the Niagara Frontier Radio Reading Service. Next, we have another division of this article, long-term planning. Erie County Medical Center will go through a leadership change this summer as well, as Thomas Quattroach Jr. leaves his post as CEO for a new job in June as President and CEO of the Healthcare Association of New York State. He'll be replaced by Andy Davis, who was named president in 2025 after a decade as chief operating officer, bringing more than 20 years' experience to the post. That plan was put in place about 2 years ago when Eugenio Russi became board chairman at the $910 million Buffalo Trauma Hospital and began talking with Quattroach about his long-term plans. And Russi says, I'm a big believer in succession planning. You can never be too prepared. And Russi serves as deputy mayor for the city of Buffalo. The mark of a good organization, Russi said, is developing the organization's staff, bringing in people who are competent, loyal to the mission, and focused. From there, he said, it's about developing them up the ranks, so there's a group of people ready to take the reins when other leaders leave. And Russi adds, it takes a lot of courage for that individual to replace himself. You'll find the most successful corporations are the ones where that leader takes the lead and starts to prepare the organization for the future, for the next generation, close quote. The decision to recruit from within versus outside the organization depends on the depth of talent at the organization, Tom says. And he adds, it depends on how deep your bench is and the individuals working for you, and secondly, how many folks you have under you to mentor. You can prepare somebody, but they have to do their part in the process to make themselves the obvious choice to move up. It's tremendously calming for an organization to have that kind of succession instead of the unknown, he adds. And finally, Tom says, if you can do that, it really is the healthiest situation for the organization, especially for an organization where it's not in a turnaround situation. We have a look at Catholic Health. Executive search firms can offer broader options. Catholic Health has used executive search firms primarily for senior level positions when the internal pool was thin. But those hires also bring a kind of balance. Some employees come to the organization and stay there for their entire careers, which has negatives and positives, according to Joyce Markievicz, CEO of the $1.6 billion Buffalo Health System. And Joyce says it's really important that we mix it up a little bit and bring in people with different perspectives who have worked in other areas so we can get the blend of institutional knowledge of Catholic health as well as what's happening in other parts of the country and healthcare, Joyce says. The organization used an executive search firm to recruit Jeremy Essman as new president for both Kenmore Mercy Hospital and Mount St. Mary's Hospital. Jeremy Essman started his career at Kaleida Health before leaving for leadership posts in New Hampshire. And Joyce Markievicz says, he gained knowledge and experience outside of Western New York and wanted to come back to Western New York, so he has a great fit. We got the best of both worlds. He had the local experience and the relationships, but also had the experience that he had gained elsewhere. Close quote. Catholic Health offers a multi-layered leadership development program that identifies what people are looking for in their career path and what they need to get there, such as coaching or mentoring. Other programs target existing leaders at varying levels, including managers, supervisors, directors, and VPs who have opportunities to level up. Succession and leadership development can also mean some people find their next role elsewhere. But that's not always a bad thing, Joyce said. And she adds, We should be growing people, and if we don't have the place for their next landing, we should be encouraging them. There's nothing wrong with that, and in some cases, they come back to us stronger, better, and more knowledgeable. Now that's the end of page 5. And let's see, I'm sorry to say page 6 and page 7 are both ads. So next we will have page 8, the future of healthcare, funding and reimbursements. And the headline reads, nursing home closings mount as need grows. Reimbursements stagnate. Operators are losing an average of $150 per resident per day, industry leaders say, pointing to New York's outdated Medicaid rates for forcing difficult decisions. Okay, now there's a picture accompanying this article by Tracy Drury, and it says, Amy McKnight, lead director of activities, walks Dennis Eberhardt down the hallway at the Autumn View Healthcare Facility in Hamburg. And I must say, Dennis has a very, let's say, interested and smiling face, as does Amy herself. So let's see what Tracy's written here about these nursing home closings. As office director at Reagan Landscape in Clarence, Jean Zabo considers himself to be fairly business savvy. But after his mother fell several times and began experiencing early onset dementia in the fall of 2024, Zabo and his siblings were completely unprepared when it was time to find a skilled nursing facility. Things got even worse when the site they found, the Weinberg campus, began shutting down. So there's a quote here from John, and remember, he's a director at Reagan Landscape in Clarence. He says, we were given 30 days to figure something out. And there's not a lot you can figure out when the person has no means. That 30 days more or less changed into 2 weeks at one point as people started moving out pretty quickly. Zabo and his siblings were also unaware their mother had taken out a reverse mortgage on her home, which left her with no assets other than her Social Security, and few options when it comes to finding a site that would accept Medicaid payments. They found a bed at Comprehensive Rehab and Nursing Center in Williamsville, he said, where his mother died just a few weeks after her transfer. And John says, and here's a quote, perhaps it was just a factor that we didn't know what we were doing, but either way, it was an ungodly, stressful experience for my mom. Close quote. The Zabo family story is likely to be repeated as nursing homes across the region face growing financial challenges tied to reimbursement shortfalls, staffing woes, and growing demand for the services they provide. Now, here's the subheading. Long-term resources shrink as the aging population grows. According to the Center for Retirement Research, around 70% of baby boomers will need long-term care at some point in their life. Western New York's baby boom population is expected to reach its peak in 2030, and those aged 65 and older already account for more than a quarter of the overall population in the Buffalo-Niagara metropolitan area, according to the U.S. Census data. Compare that to 17% of the U.S. population overall. Okay. Many local senior living facilities, including nursing homes and assisted living sites, are already at capacity, and a series of closures hasn't helped. Weinberg's shutdown came after the closure of Lutheran Jamestown's skilled nursing facility in late 2023, and was followed by the closing of Absolute Westfield in the summer of 2025. Another program at Heritage Village shut down in January. More than 4,000 nursing home beds have been lost in New York State since 2014, More than a quarter of the losses, including 800 plus in Western New York, have come since 2024, according to Sabrina Barrett, President and CEO at Lending Age New York. Barrett's organization represents nonprofit healthcare organizations focused on the aging population. Now here's a quote from, excuse me. Okay, here's a quote from Ms. Barrett. The area has lost a significant number of nursing home beds. In addition to the ones that are outright closures, there's more than 70,000 statewide that are in financial stress, reporting a negative margin. This is certainly an indicator of a potential closure and the reason why this is a system-wide issue. Barrett pointed to insufficient rates from Medicaid, which covers 73% of all nursing home residents. Today's reimbursement rates are based on 2007 costs, covering just 75% of the cost incurred. So Ms. Barrett adds, on average, our members are losing about $150 per resident per day, or millions of dollars, and they've been doing that for a long time. Their boards are having to make very difficult decisions on how do we stay open, and if we can't, do we try to sell? So here's another subheading. Selling a nursing home isn't as easy as it sounds. Those that do try to sell are finding fewer offers from the private sector. Privately owned facilities such as Absolute Westfield are struggling too. Then there are the deals that have fallen apart, including the sale of the Villages of Orleans Health and Rehab Center in Albion, which was canceled in February after a 3-year process. Joseph Morabito is president and managing member at Elemental, the group that gave up on trying to buy the Villages of Orleans. He pointed to a state approval process that dragged on for over 3 years. Morabito's companies own and manage facilities across the state. He said the balance between private and for-profit sites is vital to being able to serve everyone who needs care. And he adds, what we're seeing with the closure of nonprofit, it disrupts the balance, and that's not good. A lot of operators are being beat up. The goal is to improve either through more equitable reimbursement or better policy and approaches so the Department of Health and operators can come together around these communities that need these very critical resources. Dr. Jeffrey Rubin, co-owner of the Post-Acute Services and the Elderwood Companies, said his company isn't pursuing new deals right now while it waits to see if state health care policy stabilizes and Medicare rates rebalance. The same is true for owner Edward Farbenblum, who owns the McGuire Group homes and several other properties across the state under the Living Legends umbrella. In March, his company backed off on a deal to buy 5 Absolute Care sites, which are now slated to sell to a Brooklyn-based company. The reimbursement issue is made worse by labor costs and other regulatory requirements in New York, he says. And here's a quote from this gentleman, Mr. Farbenblum. We have some buildings definitely struggling in this environment. We are not in expansion mode at the moment. It's just incredibly challenging to deal with the wage inflation. So next we have a subheading, Inflation Far Outstrips Medicaid Reimbursement. Although the state has made several small increases to Medicaid rates in recent years, costs increased 55% between July 2007 and July 2025, while Medicaid reimbursements increased by just 14.7%, according to a leading Age New York analysis of Bureaus of Labor Statistics data. The state has proposed adding $1.5 billion for hospitals and nursing homes to its overall Medicaid budget of $38.2 billion for fiscal year 2027. It's not clear exactly how those funds would be split between the two groups. Leading Age and the providers say there's still not enough to make providers whole. Okay, all providers for-profit and nonprofit alike, are dealing with the same issues, said Christopher Koenig, President and CEO at Lineage Care Group. Lineage includes the nonprofit Niagara Lutheran Healthcare System's Greenfield Senior Living Campus in Lancaster and Schofield Care in Kenmore. He's heard of more than a dozen other facilities with 7,200 beds coming offline, while others are opting to staff fewer beds. And here's a quote, and this quote would be from Christopher Koenig. Really, not many nursing homes are in the black, maybe 15% across the state, and those that are probably a combination of foundations and specialty nursing homes with a higher reimbursement rate. Oh my. Okay, well that's the end of page 9. That's also the end of this article. And of course, page 10 and 11 are both full page ads. So we're going to be on page 12 here, and it's a whole new article. And it says here, Future of Healthcare, Technology and Transformation. And it mentions the big headline says, a healthcare system under unprecedented strain. But before we continue, I'd just like to tell you, you're listening to a reading of articles and features from this week's issue of Buffalo Business First, right here on the Niagara Frontier Radio Reading Service. Okay, now there's a picture of a gentleman here, and it says, let's see now, I'm trying to see if we can get a... Okay, this is Dr. Willie Underwood, President-elect of American Medical Association, in his office at Canisius University in Buffalo. Well, my gosh, that's great for Western New York and great for the American Medical Association. Wow. And I'm just questioning here, I wonder if he's the first to come from Western New York. Okay, and it says, Buffalo's Dr. Willie Underwood talks about the future of his industry as he prepares to be inaugurated as president of the American Medical Association. Okay, and this article is written by Leon Bunny. Okay, on page 12, Leon writes, Buffalo physician Dr. Willie Underwood sees healthcare in the U.S. facing a critical period, as he prepares to step into a national leadership role with the American Medical Association. Underwood will be inaugurated in June as AMA president, putting a Western New York-based board-certified urologist in a key position in the rapidly evolving health industry. In a wide-ranging email interview, he outlined some of the sector's biggest challenges and what he expects in the future. Now, his responses have been shortened for length. So, Leon first asked Dr. Willie Underwood, what are the biggest factors that will impact the future of healthcare? And he writes, we're seeing millions of people losing access to healthcare, grappling with the rising costs of healthcare, utilities, housing, and food that are impacting their ability to thrive and live healthy. We certainly want them to live healthy in society, and they're trying to navigate a healthcare system under unprecedented strain. Right now, 1 out of every $5 spent in the U.S. goes toward healthcare, and health inequities cost the U.S. healthcare system approximately $450 billion annually and could reach $1 trillion or more by 2040 if this is left unchecked. As physicians, we have an incredible opportunity to come together with community, business, and government leaders to shape the future of healthcare. We must create a healthcare system that works, one that works not just for the some of us, but instead for the SUM, the sum of us. So he draws the distinction between some, SOME, and SUM, meaning the total. A healthcare system where patients and their families don't have to worry about whether they can get in to see their doctor right when they need care, and a system that allows everyone to have access to top quality and affordable healthcare. That's why the AMA is committed to actively shaping the future of medicine. That includes advocating to reduce red tape, fixing prior authorization to prevent delays in patient care, ensuring physicians have a voice in health policy and technology decisions, restoring patient trust in science and clinical autonomy, and modernizing physical education to meet the demands of today's dynamic healthcare environment. Okay, and I misread that, and he says there's also a need to modernize physician education to meet the demands of today's dynamic healthcare environment. Now, Tracy asks, telehealth usage surged during the pandemic. What do you see as its long-term role? And Dr. Anderson writes, evidence has demonstrated that telehealth can be an effective substitute for an in-person care, driving higher appointment completion rates, lowering hospital readmissions, and producing significant systemic efficiencies that traditionally models miss. And next she asks, how should health systems prepare for the next wave of innovation and technology, such as predictive analytics, remote monitoring, and personalized medicine? And he writes, technology is moving very, very quickly. With the ever-growing number of applications in the healthcare setting and excitement in adopting these technologies, it's important for healthcare systems to have governance frameworks. It's important for healthcare systems to have governance frameworks in place to implement, manage, and scale technology solutions. The AMA recommends that organizations define terms such as generative AI and machine learning, articulate risks and establish rules for permitted and prohibited use cases. The AMA also advises systems to set governance, accountability, and oversight processes. And next, Leon asks, digital health tools are expanding quickly. What standards or policies does the AMA believe are necessary to ensure these technologies are safe, effective, and equitable? And Dr. Willie Underwood says, the work of the AMA continues to support physician leadership in shaping, guiding, and implementing technologies transforming medicine. Through our ongoing work, the AMA advocates for the development of high-quality, clinically validated technologies that are deployed in a responsible, ethical, and transparent manner, with patient safety being the first and foremost concern. So then Leon asks, how can technology be leveraged to close equity gaps rather than widen them, particularly in rural or underserved urban communities? And Dr. Willie Underwood writes, by combining infrastructure investment, community engagement, tailored design, and supportive policies, technology can help reduce health disparities and improve outcomes for all, not just those with the most resources or tech-savvy backgrounds. And one final question by Leon Bunny for Dr. Willie Underwood. How do you envision the AMA's role evolving as the healthcare system undergoes rapid transformation in this decade? Healthcare is changing at a pace that demands more than observation. In moments like this, the future is shaped by those willing to step forward, speak up, and act with purpose. As we look ahead, it's essential that physician leaders champion the core principles that sustain and advance our field. Our commitment must remain firm to the values that protect patients and uphold science and preserve the integrity of medical practice. The AMA will continue to support scientifically based evidence, oppose threats to medical research, defend clinical autonomy, protect patient privacy, and remove barriers to care. We will engage with elected officials and policymakers to ensure that government policies reduce administrative burdens, enact payment reform, and address burnout. Our advocacy via letters, meetings, and testimony is pivotal to reform our healthcare system. So, some words of what the future direction may be from Dr. Willie Underwood from Canisius University, who now is going to be very soon inaugurated as president of the American Medical Association. And that is a feather in the cap for Western New York as well. Okay, the next thing we'll be looking is another important, let's say, piece of the pie. The future of healthcare, retail pharmacy. And this article is written by Tracy Drury. Okay, so the headline reads, "Can independence save pharmacies?" Traditional, independently owned facilities could help fill the void left by shuttered national chains and decreased community services. And that's already happening at the Akron Community Pharmacy. So writes Tracy Drury, the author of this article. Okay, there's a number of pictures here. First of all, there's a picture here of a Akron Community Pharmacy, which opened in a former Rite Aid building in Akron. Okay, and I'm sure most of you are aware of the size of these Rite Aids that have been closed. Okay, number 2 is Padma Kumar, President and CEO. Then you have number 3 is Patrick McCullough, Supervising Pharmacist. And number 4, there's a look inside Akron Community Pharmacy. And it looks not unlike what you have experienced with Rite Aids. And let's see if there's some hope here. There's also a picture of pharmacist Bernadette Thomas and Dr. Yalamaju Kumar, who's one of the investors. Okay, so let's see what Tracy's written now. Craig Collins had worked as a store manager at Rite Aid in Akron for 15 years. And that was true when it shut down last May after the national retailer filed for bankruptcy. He had been through closures before at both Phase Drugs and Eckert during a retail pharmacy management career spanning 40-plus years. Yet he was stunned when Rite Aid closed its entire network of stores, including nearly 70 in the local area that employed close to 800 workers. And Craig writes, "We obviously heard rumors the company was closing, but we never did believe it. I was kind of like in shock." Close quote. Instead of looking to another national chain, Collins began talking with pharmacist Patrick McCullough to explore how to create an independently owned community pharmacy. They had the operations experience to make it work, but they needed an investor. Well, they found it in Padma Kumar and her husband, Dr. Yalamaraju Ravi Kumar, who put up more than $1 million to make Akron Community Pharmacy a reality. 8 months later, the retail side of the store opened in December, followed by the pharmacy in February, after final state approvals. As the national landscape shifts for pharmacy chains and community services are cut, the future for the industry could mean a return to traditional independently owned pharmacies. While they can't fill the void entirely, it's a model that's growing. The Akron site is the second new community pharmacy to open recently. Kenmore Village Pharmacy was opened in January by two pharmacists at 747 Kenmore Avenue, just down the street from a former Rite Aid at Colvin and Kenmore Avenue. They join 80 independent pharmacies located within 50 miles of the city of Buffalo, according to the National Community Pharmacists Association, which represents 18,900 pharmacies. So there's a little subheading here, filling a void in the community. Padma Kumar serves as owner, president, and CEO for the Akron Community Pharmacy, overseeing the books with Collins, who is COO and store manager. McCullough is supervising pharmacist. Ultimately, the goal is to move to a co-op model that they hope to see replaced in other communities with shuttered Rite Aid stores. And Collins says, and here's a quote, "We wanted to do something in this community to stop the vacancies. We're trying to fill that void." And the responses are very positive. People are very happy to see us. We enjoy doing what we're doing, and knowing that we're located locally owned, that's a big deal for people. Close quote. The Kumars know the company well. Since 1998, they've owned and operated Alden Medical Group just 15 minutes away, serving patients from Alden to Attica and even the Lancaster Depew area. But they knew a lot of people who were affected by the Akron closure, including Collins, a family friend for decades. And so, Padma writes, or says, "We saw the need in the community and we really wanted to help. We're passionate about keeping people in the community. I know if pharmacies end up closing, we're losing jobs and a lot of people are moving out of the state and the city. We wanted to keep our community here." Oh, stocking based on demand. At 14,000 square feet, the Akron Community Pharmacy is definitely larger than the average independent pharmacy. But the partners are making careful use of space. They've taken out some of the storage racks and left wide open areas. In addition to the pharmacy, the store sells over-the-counter medications, apparel, and beverages, plus items from local companies such as the Pink Cow Ice Cream Shop and Henry's Candy and Gifts, both of Alden, and The Ghost, owned by Patty Thomas and also Buffalo Apparel Company. There's also a stock of food items supplementing what's available from the Unimart, Pixley Shoreline Food Mart, and a local Dollar General. They're being careful about stock, however, ordering what people ask for, but not carrying too much inventory. So COO Craig Collins, who's pictured here, says, "The previous company had a lot of dead stock. We want to watch what's coming in and out to make it successful." Ravi Kumar said he and his wife see the project as a purpose-driven business versus a revenue generator. He expects the investment will mean he'll have to work an extra 5 to 10 years before he can retire. Excuse me. But Ravi states, "We're all in. We cannot let private equity groups and out-of-state groups own the pharmacies. These are essential services we cannot lose. I'm not going to let this sink." Well, that's a pretty definitive statement. Okay, now there's another subheading. It looks like it actually rounds out the rest of the article. And it says, "How new life has been for closed stores. Is there any?" Half a dozen former Rite Aid stores across the region have been sold over the past year, with buyers planning supermarkets and dollar stores. There's several models that could work for others looking in open a community pharmacy. Akron Community Pharmacy is leasing the store from Benderson Development, which owns dozens of shuttered Rite Aids. "The project makes a lot of sense," said Eric Raccoon, Vice President for Leasing and Development at Henderson. And Eric says, here's a quote, it will be potentially catalysmic for this community, he said. We own some other Rite Aids, and we're talking to a lot of different people about a lot of different things. That is a true Rite Aid replacement. McCullough, supervising pharmacist, is one of the pharmacists they want to save. He's joined by 2 part-time pharmacists who are part of an 18-person workforce, down slightly from the 28 who worked there under Rite Aid. McCullough worked for Eckerd until it was bought by Rite Aid, starting out as an intern during pharmacy school 28 years ago. He was working at the store in Alden when the company closed. Now he's putting lessons learned from his years in the corporate world into a new venture. We learn to watch for the pitfalls that corporate fell into, wasting money. The patient role is growing slowly as well, he said, giving the pharmacy time to get its system and procedures in place. Where Rite Aid filled thousands of prescriptions weekly, Akron is filling 6,100 daily. That's expected to increase by 20 to 25% once the store is approved for additional maintenance insurance coverage through Medicaid and Epic. Even though it's early days, they're already hearing from other communities left without a pharmacy where their Rite Aid closed. And Padma says they want to duplicate what we're doing here for Akron. I hope we can help them out in the future because this was a big undertaking. We have a great team here. I think they see that and they want to see that happen with their own communities. Well, there's certainly a ray of hope in that article. Now that's the end of page 17. 18 and 19 are full-page ads, so we'll be getting to page 20 right away. Okay, this is repurposing real estate. Vacant medical facilities are filled with opportunity. Okay, and there's a picture. This must be a drone picture. It's taken so close, but on high, of the old Children's Hospital facility right near Elmwood. Jacob Tierney writes, as healthcare facilities consolidate and all revenue streams count, unused properties hold potential. Many former hospitals and other medical buildings stand vacant in communities across the United States due to the changing nature of healthcare. They present an opportunity for both private developers and nonprofits looking to create housing, but converting a hospital building into apartments is not an easy task. Not too long ago, it was common for most communities to have their own hospital. Inpatient stays were longer and more frequent. Now, healthcare facilities are consolidating and outpatient care is the norm. Ann McCaffrey, president and CEO of People Inc., says, that has changed the real estate of hospitals pretty dramatically. Each small community doesn't need hundreds of hospital beds any longer. So it really has created a question for communities that had full-service hospitals. What's the community response to these large buildings? Here in Western New York, People Incorporated has been part of that response. In 2023, the agency opened Fowle Senior Apartments, a $15.3 million project that added 44 affordable units to a building that used to be part of Women and Children's Hospital of Buffalo. In 2026, People Incorporated opened Blocher Apartments, a $42.6 million 93-unit conversion of the former Blocher Homes assisted living facility in Williamsville. And the organization recently announced plans to turn the vacant inpatient tower at DeGraff Memorial Hospital in North Tonawanda into senior housing. Fowle Senior Apartments was People Incorporated's first conversion of a former health care property, and it set the template for what was to come. We can play, she says, a critical role in converting empty healthcare spaces into new use that's meaningful to the community. McCaffrey, who formerly was president and CEO of Eastern Niagara Hospital in Lockport. People Incorporated is just one of several stakeholders involved in repurposing the former Women and Children's Hospital in Elmwood Village. It closed in 2017 as Kaleida Health moved operations to the new hospital on the Buffalo Niagara Medical Campus. Developer Nick Sinatra was there the day the hospital shut down and patients were transported to the new facility. And Nick says, "It's a fully functional hospital until the moment it's not. The transition was a masterpiece. I was so impressed." Kaleida initially chose Simonelli Real Estate to redevelop the site, but that plan fell through, so Kaleida then chose a partnership between Sinatra and Company Real Estate and Ellicott Development. Sinatra said he saw plenty of upside in the deal. It's a dense, well-maintained property in one of Buffalo's most desirable neighborhoods. And because it was a hospital, it didn't have a major downside that plagues most historic properties. However, there are also challenges to turning hospital buildings into apartment. They weren't designed as long-term residences, and large floor plates made apartment layouts tricky. Sinatra said the biggest challenge his team faced was not his architectural challenge, but community pushback. The developers faced significant resistance to the project in Elmwood Village, some from Elmwood Village. Had it not been for the 2 lawsuits that we encountered on this thing, we would have had this whole project done today. Then COVID-19 hit, which killed plans to put a hotel and office space on the site. So, Sinatra and Company finished converting 2 buildings there into apartments. In 2024, it opened the Barton, a 24-unit development in the same building as People Incorporated's Falwell Senior Apartments, and it completed the annex, a 36-unit conversion of another building at the hospital. Those are performing well, says Matt Connors, Vice President Development for Sinatra and Company. We're proud of those, but it would have been nice to tackle everything. The 2 large towers on the site remain vacant. Ellicott Development has pitched several projects, most recently a $45 million mixed-use project with 135 apartments and 94,000 square feet of commercial space. But this has been on a prolonged pause due to the downturn in local development. Okay, well, that's the end of that article by Jacob Turney. Vacant medical facilities are filled with opportunity. So, you've been listening to a reading of articles and features from the May 8th through 14th issue of Buffalo Business First. And you know, we read from Buffalo Business First every Wednesday evening at 7 p.m. Your reader has been Fran McNamara, and I really thank you sincerely for listening.
Coming up next in the Niagara Frontier Radio Reading Service, we have Time Magazine. At 8 o'clock, we have the New York Times, and at 9 o'clock, we have our comic books. From our friends at Comicstorian, we bring you the back half and the conclusion of Devil's Reign, the big Marvel crossover event, and then issue number 2 of the 2025 run of Batman by Matt Fraction. Stay with us. The following program is intended for listeners who are blind, have low vision, or have another print disability,